Before we dive into today's episode, I wanted to let you know about some exciting things we have been working on at Advanced Women's Health. So, we don't aim to just be excellent at appointments and excellent with the care we give to patients in terms of the protocol, but our goal is cross clinic excellence. We want to ensure that you are getting the most wonderful onboarding experience, that you feel supported, and that fundamentally you actually are going to implement your plan. We talk about health being a lifestyle, and it is, right? It is something that needs to be modified or shifted. We need to think about things differently. We need to understand our bodies differently. We need to have those education-based aha moments or those community-based aha moments to be able to action what we know to be true and what we know we need to do. And so, over the last few years, we have been consistently evolving and trying to give you the best patient care experience possible. And that has resulted in us having our new patient onboarding system. All new patients at Advanced Women's Health now get access to a plethora of resources. We go through educational pipelines and daily tips and tricks that will help you to implement your plan. We have mindset support. We have onboarding coordinators that are there to create community and hold your hand in live QA calls. We offer meal templates and meal plan structures, exercise videos and programs, community challenges, and so much more. And again, this is just included as being part of a patient of Advanced Women's Health. So if you have been on the fence, if you have been hesitating, book with one of our patient onboarding coordinators. We are here to help you pick which practitioner is the best fit for you. And then you can learn more about our onboarding systems and everything else we offer at Advanced Women's Health. So now to the episode. Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast. Hello, everyone, and welcome back to today's episode where we are going to dive into fertility from the perspective of hormones and something we don't talk about, I think, near enough, which is blood flow. So, as we're diving in and navigating this fertility journey, make sure if you haven't, check out the last two episodes. We have this one, and then we have our final episode where we are going to just dive into structural anatomy. We're going to dive into like can egg and sperm meet and all of the important pieces there. And this is something that we've been talking about a lot in our advanced fertility consultations. There's so much education, there's so much to know, there's so many even conflicting pieces of information that can come up when we're talking about the world of fertility, of hormones, blood flow, what's important, and all of these things. So we're just going to navigate from that perspective today. So we have a lot of episodes on the podcast where we talk about the hormone cycle and what is normal, quote unquote, within the context of hormones. So what we want to see just at a basic level, and again, feel free to review those previous podcasts, but at a basic level, what we want to see is the first part of our cycle is called the follicular phase. Okay, well, technically, some people split this up and they say it's menstrual, which is when you're bleeding, follicular, which is when follicle is developing. That's when they call it follicular. Then we have ovulatory, which is just a little hot moment in time. And then we have luteal. And so luteal is when after ovulation, after that egg leaves the ovary, my kids call it hatching. That's a whole other conversation. My 4-year-old will come up to me and he's like, "Do you have an egg in your belly today?" Like the chickens, right? I'm like, "No, not today. Give me a couple days. It's coming." But anyways, when it hatches, that kind of coming out, that ovulation process, that's really when we see what the remainder left over in the ovaries, the corpus luteum. And that corpus luteum is making our hormones. So I am giving you this at a very bare bones level because, to be completely honest, this is why we have doctors. You guys don't need to know the ins and outs of every signaling compound and how everything works. You should be able to go into a practitioner's office and have confidence that they've got you held and supported, and that you don't need to be diving down the Dr. Google hole, and you don't need to be one step ahead of them in terms of what the best quality care is. And we hear this all the time. So I'm going to break it down for you again at that level. So what should happen? Menstrual phase. So essentially our estrogen and progesterone that were high in anticipation of a pregnancy, they were elevated due to in that luteal phase, which we'll get back to, right? They drop. When that drops, we trigger menstruation and that bleeding process. And then as that's happening, we have our next follicle developing. And we talk about this a lot, like that follicle started developing 3 months ago, right? So when we're looking at egg quality in the environment that our eggs are in, we really do have to look back 3 to 6 months. And this is important because the health of the developing follicle and the cells around the outside, called the granulosa cells, is going to dictate how much estradiol you're producing in the first part of your cycle. That's also going to dictate how high your estradiol goes at ovulation, which is one of the signs that we do have of quality of that egg and quality of that follicle, is how much estrogen can it produce. And so as we're moving, we should have a low-ish level of estradiol, right? So in our Canadian units, we're looking for this to be kind of over 80, less than 180 type thing. And then we navigate towards ovulation. That's when estradiol starts to rise, triggering that we have an egg that's ready to be ovulated. Then we get a trigger from our brain of luteinizing hormone, right? That causes ovulation. And then we have that estrogen or estradiol come back down. Then we have a few day window here, and you can test this in the lab. So in serum, you can test this with a fertility clinic. They're doing serum, and then they're also monitoring your, like, on ultrasound. But then you can also test it with at-home urinary hormone tests. The one that we use most often is called Mira. So ovulation, we have this couple day kind of break where the hormones drop a little bit. And then we should see progesterone and estradiol rise again in the second half of the cycle and be stable to be able to cause the lining to be ready to receive a fertilized egg and then be able to grow and develop into a healthy pregnancy. And so with that, these are all very, very important steps, clearly, as we're going through. And so our diagnostic is looking at what hormone levels are present at what phase of the cycle, and are they adequate? Are they stable? And is that something that is a sign of a bigger issue? So let's break that down. So in the first half of that cycle, the follicular phase, if you have a very high or very low level of estradiol, then that in of itself is diagnostic. It's concerning. So a low level is telling us one of two things. Your brain is not telling your ovary to develop a follicle. So that's follicle stimulating hormone, right? We're not getting enough of that stimulation, or the ovary, right? The second part of it is the ovary is not responding. So whether the ovary is not responding to the signal to develop an egg, or whether the egg, right, and the ovary, the follicle development is not healthy enough for those granulosa cells to make estradiol. So one of the two is happening, right? We're not making enough estradiol because the cells aren't healthy, or the signal isn't getting there. So that's kind of our first pass. What's going on here? Is there something to be concerned about? On the other end of it, if it's very high, then we're looking and saying, okay, maybe there's an ovarian aging component here. And when we start to see less eggs and less healthy eggs, we can start to develop multiple and then push out a ton of estrogen. And that is a sign of perimenopause, but it also can give us an indication outside of perimenopause that there's something abnormal. Another reason for this could be an estrogen producing cyst on the ovaries. So that's why ultrasounds and imaging is always really helpful. So that's kind of our first diagnostic, is what's happening with these developing follicles. Then we look through and we look at ovulation. And so at ovulation, as I mentioned, if you don't have enough estradiol, right? So they say about 500 picomoles should be made for the developing follicles. So if you have one, right, then we're looking at that being around 500. If you have three, it can go up to 1500. So that if you can catch that day of peak estradiol, then it can be very, very high levels, but for a very short period of time. And then we get our luteinizing hormone spike. So again, if we're testing at ovulatory estradiol and we see that it's 300, you may be ovulating, but it makes us ask questions about the health of the ovary and the health of the cells and the health of the egg. Then we move into the second half of the cycle. So traditionally, if we are measuring or testing for progesterone and progesterone sufficiency, which progesterone is very important, progestation, baby making hormones, right? These are important hormones. But if we're looking for sufficiency, they will say, okay, go 7 days after you ovulate and do a blood test. As much as that can be helpful, it also misses a lot, because the immune system, as we've talked about in the past, and our brain and the lining of our uterus like consistent hormones. So even if you have a progesterone level that's over 50 on blood work, but it's only over 50 for that one day, or it's really fluctuant up and down, that is still telling us that there are concerns with the health of the corpus luteum. And there are concerns with, again, like the blood flow and circulation, which we'll get into in the second half of this. So when we're looking, again, if we're using a hormone test like Mira, then we're getting someone to test every 2 days. Sometimes people test every day. And we're looking at the consistency of the hormones throughout that second half of the cycle. We're also looking at how many days we can maintain that second half of the cycle, or that luteal phase. Because even if you have an adequate level of progesterone, right? So it's a great level and it's stable, but it's only 10 days of stability and then it drops and then you start to menstruate. That is telling us that you cannot maintain hormones long enough and you actually don't have enough time. You could have a fertilized egg developing, right? You could have this embryo implanting. And because the progesterone drops, it then starts to the process of shedding the lining before the hormones can build up from the developing embryo, can build up to the point that our brain knows we're pregnant and turns off that process of shedding the lining. Again, oversimplifications here, but important pieces to break down. And so these are all of the things that should be looked at. This is like a minor overview, but these are the things that we should be talking about as we're navigating fertility consults and fertility journeys. These are the types of things your practitioner should be walking you through. So they're like, okay, this is what's happening in the first half of your cycle. This is what it's telling me. You're developing a perfectly fine follicle. Everything is looking good. And then at ovulation, that's where we see the issue. You don't actually get that estradiol spike, or it looks good at ovulation and your estradiol may be able to be maintained, but your progesterone is not high enough, or your progesterone is high enough, but it's not long enough. And so we need to lengthen the cycle. And so when we get all of that information, we have a lot of different things we can do in terms of hormone modification. Obviously, if your progesterone is not high enough, taking progesterone orally or vaginally or injecting it are all very viable options to help maintain that lining of the uterus and help to maintain a healthy pregnancy until the placenta takes over, which happens later, right? So placentation is the process. The placenta doesn't really take over in a big way until that 12-week mark, which is part of why we view that as the window where a lot of people are like, okay, I'm out of my first trimester. But anywhere between kind of 10 and 14 weeks is when we're really depending on our placenta for all of those hormones. And so until that period of time, if you don't have this healthy corpus luteum or this healthy shell of the egg, right, then we're going to be dealing with the drive in many situations to put in external hormones as a prescription. We also obviously can work on this in a lot of other ways. If you're like many of our patients that are struggling with your health, then you have looked into one of many, many, many programs online. There are programs with doctors, with naturopathic doctors, with functional medicine practitioners, with nutritionists, with people who have been through what you are experiencing. There are so many options available online. But the reality is, a lot of these programs are not medically guided. When you sign up, they say right away, this is not personalized to you. This is not personalized to your labs. I can't diagnose you, which is a huge limitation. They're also very costly. Many of these programs are $2,000, $3,000, $5,000 for a 3-month program. And that leads to you, one, not getting the best standard of personalized care, and two, spending money that you may not have to. And that's where our clinically guided programming has come in place. I have wanted forever to be able to give people an educational system, a week by week guide, an exact system so that you know what you're expected to do, what you're expected to eat, and how you're expected to navigate week over week over week over week. And I have been working with my team, my clinical teams, my clinical assistant to be able to roll out structured programs for you that are in the hundreds, not thousands of dollars. We are so excited to launch our advanced metabolic rehab, our fertility programming, and so much more upcoming. If you are interested in learning more about our structured and clinically guided programs, make sure you reach out to the clinics, info@advancedwomenshealth.ca. They will connect you with one of our clinical assistants and guide you through what programming might be best for you. The best thing is that these are in and above your appointment. So you are having your naturopathic visits, your acupuncture visits, and then we are layering on top a supported experience that allows you to utilize extended benefits should you have them, but that also allows you to get, again, a highly tailored medical environment. So reach out to us if you have more questions. And now back to the episode. So when we look at how hormones are made, this is where the dirty, nerdy piece comes in, right? So we make our hormones using cholesterol and fat. So again, very important that we have appropriate amounts of those ingredients in the hormone making process, right? We then need a healthy mitochondria. So the mitochondria is the energy powerhouse of the cell. When we're talking about egg quality and egg quality supplements, almost all of them are feeding into there's something, again, going way, way back, there's something called the Krebs cycle or the TCA. Don't stress biology. If it was my friend, clearly, this is my job. But if it wasn't your friend, then you're good to go. But essentially, these mitochondria, if you just picture it like a water wheel, right? Or just a wheel that's turning, in order for everything to move to the next step, you can't jam the cycle. So if you want that wheel to keep turning, right, and that water to keep moving, and that water being energy, if you want that energy to keep moving, then you need to make sure that cycle turns efficiently. And that's where B vitamins are very important, CoQ10, carnitine. A lot of these nutrients are very important to keep that cycle turning. So if we run out of CoQ10, quote unquote, or we don't have enough, then that can slow down the cycle, slow down our energy production, and also slow down our hormone production. So that's why it's really common to hear about those nutrients being added in. Then we look at other things that are supporting the mitochondria, not inside, but from the outside. And so these mitochondria are very sensitive to a process called oxidative stress or rusting. And so that rusting process in our cars, right? If our car just breaks down, we see the rust, we go to the rust check people, or again, it just starts to disintegrate. Whereas with our bodies have the ability to heal and repair. And so the other kind of two categories of things that we give for egg quality and hormone production are what we call antioxidants. So these are things that are reducing that rust, right? These are things that are coming in and kind of coating it and in our body allowing it to then heal. So that's antioxidants. So these are things like N-acetylcysteine, resveratrol is a common one. There are vitamin E, vitamin C, like there's so many antioxidants that are available. And then the kind of last category there is the things that we use to reduce the amount of oxidative stress or damage in the first place. So this is when we're dealing with the bacteria, we're dealing with the virus, we're dealing with the immune stressors, we're dealing with the environmental compounds and toxins, we're dealing with the things that are causing the rust to begin with. And so that when we're looking at making healthy hormone levels, these are all really important pieces. We need healthy brain signaling to ovaries. We need all of those nutrients to help to support the mitochondria and hormone production. And then sometimes we're layering in more sophisticated things that strengthen that communication between the brain and the ovaries after we're confident we have all the nutrients we need. That's something like Vitex or Chase Tree, right? And these are all things you've likely heard of or will hear of in your fertility journey. But one of the big missing pieces with all of this is all of these nutrients. And this is what I say to people all the time. We're taking these nutrients, right, orally. So we're putting them in our mouth. We then need to break them down in our stomach, absorb them. Then they need to get into the bloodstream. That bloodstream needs to take them to the ovaries. Then they need to get into the ovaries, like the mitochondria within the ovaries. And then we have to have that sit there for a 3-month period of time, watching and waiting and hoping that process is going to work. So the big caveat within all of that is circulation, right? If we don't have proper blood flow taking those nutrients and taking all of the nutrients we need to the ovaries and then removing all the waste from that process, then that lack of blood flow is really going to decrease the number of follicles we have. It's going to decrease the number of healthy eggs in follicles. It's going to decrease hormone production and hormones getting where they need to go. It is going to decrease the brain communicating with the ovaries efficiently. There's just so many of these pieces that become really, really critical. And when we're doing acupuncture for fertility, a lot of the things that acupuncture has research on fundamentally comes down to its wicked ability to support circulation. So it has been shown to be anti-inflammatory. It's been shown to support egg quality. It's been shown to support the communication between the brain and the ovaries. It obviously supports the stress response. There's so many beautiful things acupuncture does, but at the core, at the end of the day, it's bringing really great blood flow to the lining of the uterus, which is getting those nutrients, removing that inflammation, getting all the anti-inflammatories in there. It's getting things to the ovaries. Because one of the things we saw a lot and will continue to see is that the post-pandemic, so again, there's a number of viruses that do this, but viruses can affect blood's ability to clot and how quickly it clots. They can affect blood flow and circulation. And so we really, as a clinic, kind of woke up to this and we started to double down and focus on how much circulation and clotting support we were giving patients on their fertility journey during the pandemic and subsequently, because we've seen really significant shifts. And in the research, they do a type of ultrasound that we could do, and many clinics do, they just don't report on it, that looks at how much blood flow gets to the ovaries and the uterus. And we saw a significant decrease in that blood flow associated with a significant decrease in healthy ovulation, in the hormones that are being produced, in live birth rates. And so ensuring that, again, when you're talking to your practitioner, the circulation part of the conversation is an active part is really important. So if you get really cold hands and feet, none of these things are diagnostic, by the way. The blood flow that goes to your ovaries is different than the blood flow that goes to your fingertips and your toes, but it's just a question that we ask, right? So if you are getting really poor circulation to your hands and your feet, if you got COVID toes, which is where you get this really significant discoloration and a circulatory issue post-viral, if you have Raynaud's, or some of these other circulatory issues, if you've ever been told that you have a thin lining on ultrasound or you've had a cycle delayed or canceled because of a thin lining, one caveat to this is oftentimes people will have light periods and they're coming in really concerned that this means they have really poor circulation and that they have a thin lining. It can mean that. It can. It doesn't always, though. And so we need an ultrasound to say, like, do you have a thin lining? Is this something that we need to be concerned about? For some people who experience POTS or postural orthostatic tachycardia syndrome, so If you feel like your heart races when you stand up or stand for long periods of time, if you feel like you get dizzy and your heart races when you stand up in general, if you see like stars, right? These are all different circulatory signs and symptoms. In addition to the diagnosis, if you have hypertension, then that can have negative impacts on blood flow, and that can have negative impacts just in general, because the question then becomes, why do you have that? Like, why do you have hypertension when you're in your reproductive years? You could ask the question, why do you have hypertension in general? But when you're in your reproductive years, it's not common for a female to have hypertension. So we ask, okay, what else is going on with blood flow, with insulin? What's going on with inflammation? What's going on with all of these different factors? So when we're looking, we then see that, again, our ability to make hormones is something that is flexible. Our ability to change circulation is something that is modifiable. Even when we look at those red light belts, right, that are popular now in red light therapy, that's changing circulation and supporting mitochondrial health and quality. There's lots of new research coming out of them in the fertility world. But we need to always be thinking about, has someone appropriately diagnosed me in terms of where I'm at in my cycle? Do they know that I have the appropriate amount of hormones to indicate potentially the health of these follicles? Do they know that I have enough hormones for long enough that I can have and sustain a pregnancy if I do get pregnant? Do we have any signs or symptoms of what could be going on with that egg quality from the hormone production from our ovaries? And then again, what are we thinking about? How are we investigating blood flow? Obviously, if you can get a uterine blood flow and ovarian blood flow ultrasound, well, that's one indication. But we also look systemically at the whole body and say, are there signs or symptoms here that we need to be very mindful of blood flow? And we need to ensure and support additionally above and beyond movement and exercise, which are critical for blood flow, right? Do we need to go above and beyond here and look at either supplement intervention or acupuncture intervention, et cetera, that's going to bring all of those beautiful nutrients and all of those anti-inflammatory compounds and all of those antioxidants to our ovaries and our uterus to allow us to get the outcome we're after. So I know today's episode was technically heavy, but for anyone going through this journey, and again, as someone who talks to patients all day long about these fertility journeys, these are oftentimes the questions that are coming up and the points of confusion people have. So I wanted to make sure I sat down and recorded something for you guys that you can go back to in the future that will give you a sense of where and how to be investigated. So we want to ensure we're doing cycle day 3 labs and ultrasound. Ideally, if you're in cycle monitoring, then you're going to be watching the development of those follicles and watching how the brain talks to the ovaries and how those ovaries are making hormones. If you are not, then you're at least going to do your cycle day 3 hormones. And then you are potentially looking at your luteal hormones in serum. Or again, we have the options now to do Mira and some of these other at-home urinary hormone tests that give you that opportunity to track and look at consistency throughout the month, the length of your luteal phase, and so much more. So there's so many actions you can take into your hands, again, whether that is with diet and anti-inflammatory nutrition, healthy fats, whether that is walking and moving your body in a way that's helpful, or supplements. This is such a critical part of the fertility journey, but it's also, in the grand scheme of things, one of the very modifiable factors that we have. And so understanding it and taking action is key to your success. So I hope that was helpful. I hope you've been enjoying our little fertility series, and I will talk to you guys very soon.
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message, and that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.